Hey, welcome back to New Day Northwest. When it comes to mental health, some of us have better access to care than others, and that can be especially true when it comes to young people. Now, here with a look at what's going on with youth right now is Dr. Chris Ladish, the Chief of Pediatric Behavioral Health for Marybridge Children's Hospital in Tacoma. Thank you so much for being here.
Thank you for having me.
I think this is something that we don't talk about enough, the mental health for kids, because I think it's so hard for parents sometimes to know what to say, what to do, or when something is wrong. But do you believe that there is a mental health crisis with kids happening right now?
I absolutely believe we're in a mental health crisis. I think that we have been in a crisis for over a decade. I think the pandemic has just shined a light on that crisis, and fortunately we're starting to bring resource to the need.
I had been working as a medical health reporter before I started this job, and I remember a couple of years back talking to medical health professionals, mental health professionals about the lack of care and the lack of ability and available resources. How long has this been going on? If I know that from a couple of years ago, I mean, has this been going on before that?
Yeah, it's been going on for over a decade. About 2011 is where we really started to see an increased rise in rates of depression and anxiety for youth, as well as suicidal behavior and suicide risk.
Oh my goodness, it's so hard when we're thinking about kids feeling this way. So what can parents do to help support the children, and how do we manage this as we continue as parents to struggle with the pandemic, stress, money, all the other issues? How do you do it?
Yeah, well, I have kids too, and I think the most important thing to remember is that as parents, how we are interpreting what's going on with the pandemic and the impact in our lives is not necessarily the same way that our youth and our kids are interpreting it. So I think it's important to ask and to observe and to let our kids know what we're seeing. I think if we can identify, you're spending more time in your room, you're telling me that you don't feel like you have friends, you're telling me that you feel like you can't sleep, let's talk about that.
Yeah.
And then to listen to what they have to say, and over time, if we can get them to engage in resources, I think that's most important.
Absolutely. Can I ask you a little more about the symptoms and how to get kids to start talking? I think we often associate teenagers with the ones who are having severe depression, but I know that younger kids can deal with this as well, right?
Yep.
How do you identify that in, let's say, a 7-year-old or a 9-year-old or an 11-year-old?
Well, I think the first thing to look for is just any dramatic change in behavior, right?
Okay.
If your child starts acting atypically and that atypical behavior is going on for more than several days, more into a week or two, that's a time to really start paying attention. I think kids know parents know their kids best, and so, listening to your gut and watching what's happening, I think it is easy for us to say, well, of course, they're going to be angry, they're not going into school. That doesn't mean that it is okay what they're going through, and that we really want to see if we can bring more resource to the problems that they're facing. So I think, listening to our kids, asking the right questions, and then really just sitting with what they share with us, and over time letting them know that there's help available if they're willing to participate.
That's important to let them know that they're not alone in this. What if I'm a parent who might be watching out there right now and they're having concerns about their child and don't know where to turn, or they've tried but they can't find any access to any resources? What would your advice be for that?
I think we really want to look where kids participate in life. So school districts, school counselors oftentimes know numbers to call. The child's pediatrician is a good place to turn. If any child is in crisis, 1-800-273-TALK is the national crisis line. A parent can call that number. In July, we'll have the 988 line that parents can call as well. And so awesome. I think, looking first to talking to your child, moving it on to working with the school district and your pediatrician is probably where to start.
That is great advice. Anything else that someone should know about this crisis, know what we should be doing, or if there's anything any of us can do to help?
I think the most important thing I would want people to know is that this crisis is too large for any single person or any single entity to manage. This is a systemic problem, and it's going to take all of us working together to kind of raise these kids collectively and to help them achieve, mental health and wellness. And so I think we really need to just all be looking for it. I think we need to operate out of a place of assumption that the past 2 years have been devastating for kids, and we need to expect that they're struggling, rather not wait until we see them struggling. We need to ask early and often about how they're doing, and just check in time and time again. And don't assume that, you know, if they're doing well now, it's going to mean that they're doing well in 2 weeks. We really need to continue to check in.
That's such great advice. Ask early, ask often. And you would just say, hey, how you doing today? I mean,
right.
okay.
And I think normalizing it and saying, you know, a lot of kids are struggling. You know, we're hearing that kids are feeling sad more often than not. We're hearing that kids are feeling anxious while they're back at school. What are you noticing? What are your friends talking about? Just making, you know, kind of normalizing
just
the
putting
conversation.
It out there.
Absolutely.
All right. Thank you so much.
My
It was
pleasure.
such a pleasure chatting with you today.
Nice
We'll
to
see
talk
you
to you.
again soon. Meantime, Dr. Ladish and I are actually both part of MultiCare's Changing Minds event, which is happening tomorrow, May 4th. If you'd like to learn more, we've got a link to that on New Day's website. Go check it out.